It's the end of November, it's the time of turkey and Thanksgiving feast, it's the start of the holiday season, the holiday shopping season, but November is something else as well. It is Adopt a Senior Pet Month, and if you happen to have a senior pet of your own or are thinking of potentially adopting a senior pet for the holidays and beyond, well, with great senior pets comes great senior pet responsibilities. So what are some of the things that you as a pet owner need to be aware of when it comes to making sure your senior pets stay happy and healthy through their golden years? Come on a drive with me and let's find out. Thanks for coming along with this little drive through the countryside with me here as we talk everything and anything to know about senior pets. And of course, as I said, senior pets, they make wonderful pets. And a lot of our dogs and cats are definitely living longer now thanks to both better care and, better modern medicine for them. So I figured with it being Adopt a Senior Pet Month and all that, we would take a nice little chat about everything that is important when it comes to senior pets. And of course, the first question that probably pops up, before anything else is, well, at what age is a pet a senior? And it varies a little bit depending on what chart you use, but we've really gone away from the whole a dog or a cat ages 7 years for 1 year. It doesn't work out quite to be that anymore, and as you can see with the chart that we have here, we consider most seniors once they start reaching around 7 years of age, and that varies, of course, based on a couple of factors. When in dogs, certainly breed size, breed type, body weight, things of that nature, because it definitely does make a little bit more of a difference in determining exactly when they're seniors. But we put it 7 years old probably at a nice even round number. And again, you can look at this chart. It just kind of gives you a little bit more information, and you can see many charts that show exactly how your pet ages for every year, what they equate to human years, and things like that. It's always important to remember, and we say this all the time, age is not a disease. So try to remember that as well. Just because a pet is a little bit older doesn't necessarily mean that, things are really bad with them. We've had many pets that lived wonderful lives into their golden years, well past 7 years old. So, keep all of that in mind as well. In general, though, because they are older and more senior pets, we do ask that you bring them in to be examined, usually every 6 months if everything looks good, definitely at least yearly, but we really try to push for every 6 months because we want to be able to catch things early with senior pets. And it goes to the same idea of an ounce of prevention is worth a pound of cure. Definitely works more than when it comes to senior pets, because sometimes it can be more difficult to treat some of these conditions if your pet were to develop them, but if we catch them early, we definitely can make things a lot easier for you and your pet in treating some of these conditions. So there's a lot of different things when it comes to looking at senior pet health that we focus on, but we're going to try to focus on 5 major areas that I'm going to talk about as we enjoy our little drive here. And those are metabolic diseases, arthritis, dental issues, heart disease, which we can see from time to time, and one of the bigger things that we're noticing with older animals nowadays, and that is senility and cognitive dysfunction, sometimes they call it as well. And so we'll be talking a little bit about that as we go. But let's focus, kind of on number one on that list, and that's metabolic disease. And we're kind of break that down into 5 categories of its own, because when we talk about metabolic disease, we're really talking about the different body processes, different organ systems, things that we might need to worry about a little bit more as a pet ages. And the first of those is we're going to look at their liver function. And this is, of course, is something that blood work is going to help us a lot with in looking at all the things we're going to talk about. But, certainly liver function is one thing that we look at as an animal ages. The liver may start to not work quite as well, or start showing some signs of if there's a potential tumor going on in the liver, or if there's some other problem as far as not being able to process or clear toxins as well. All of those things are things that we would look for. And signs that there might be some liver issues in your pet might be some vomiting that seems pretty consistent. You might notice some evidence of not wanting to eat quite as well. The animal may seem a little bit more down, not doing quite as well. And of course, the big one, if there's a major potential liver problem going on, would be that they start developing a little bit of jaundice or yellowness of the white parts of the eyes, or their skin, or their gum color. So obviously, if you see any of that, get your pet to your vet right away. We definitely want to work that out and see exactly what's going on. The next area that we kind of look at is their kidney function. And I will say this about older cats. Any cat that does live long enough is going to suffer some form of what we call chronic kidney disease or chronic renal disease. And that is certainly something that we worry greatly about, because if we catch it early, again, we can start to do some things to potentially help in all of those areas. So signs that there might be some kidney issues going on with your pet as they age would be usually increased drinking and increased urination. So if all of a sudden you see your cat or dog just constantly drinking at the water bowl and then urinating a ton. So for cats, that usually means you notice all of a sudden that you're scooping a lot more out of the litter box, or the litter box is totally saturated with urine. And with dogs, just needing to go out more frequently and things like that. So if you notice any of those signs, obviously let your pet know. And the reason that occurs when we're talking just about chronic kidney disease here, which is kind of the bigger thing when it comes to older animals, is the kidneys are an amazing organ in the fact that they can lose approximately 75-ish% of their function before you even notice there's a problem, or before the animal is even affected. I mean, that's just how much redundancy is built into the kidneys. But when you start hitting those thresholds, you really do develop more of a problem where the kidneys cannot concentrate urine as well. So one of the big issues with kidneys, and one of the things that obviously they're most important for, is concentrating urine, so saving water, so conserving water for the body. And if the kidneys can't do that, basically your pet's just going to urinate more and more, because their bladder's going to fill up much more quickly with urine. And that's what happens, is they tend to pee a lot more, which makes them dehydrated, which makes them want to drink a lot more. And again, there's blood tests that we can do to try to catch this early. There's things we can look for in urinalysis samples to make sure that everything is functioning well with the kidneys. I will say that once kidney damage is there in a chronic kidney state, we can't reverse it. We can do a lot of stuff, though, that's very easy to do. It doesn't require specialist care or anything, to slow the progression sometimes down to almost nothing. It's always going to progressively get a little bit worse, but we can do things with fluid therapy and medications and diet changes to really help those kidneys and prolong quality of life as far as all that goes. So, that would be one thing to look for. We look for as well is kidney function. Another thing that actually can cause increased drinking and increased urination is diabetes. And we do see diabetes both in younger animals, but usually we start to see it creep up more in senior animals. Most every animal that is affected with diabetes is going to be a type 2 type of diabetes, where they just either don't produce quite as much insulin as they should, or their body gets a little more insulin resistant, anything like that. And you certainly, again, when we do these blood tests and blood checks, that's one thing that we look for is to see how their sugar is doing, to make sure that everything is going okay with their blood sugars. If it does appear very high, we're going to check to see if they're spilling any glucose into their urine or sugar into their urine as well. But if you do see any evidence of increase drinking, increase urination, you definitely want to talk to your vet about having your older pet checked for diabetes to make sure that nothing is going on there. And again, these are things that we certainly can treat. It's not difficult to do. It does require a little bit of time sometimes in getting the insulin doses right, but most of the time we normally do okay as far as all of that goes. Sure we can get through here as we move on to the next topic. And the next one that we do see both in dogs and cats is issues with their thyroid glands. So the rule of thumb is usually dogs develop hypothyroidism, cats develop hyperthyroidism, and the symptoms of each are drastically different. So you have to think of the thyroid really as a gland that helps control so many things out there. And it's responsible for metabolism, it's responsible for hair coat sometimes. It's just the thyroid hormone has an effect of acting on so many different systems that we want to make sure the thyroid level is normal. So as I said, in older dogs, we do sometimes see their thyroids become underactive, so they don't produce enough thyroid hormone, and as such their metabolism slows down. So you will notice signs of them maybe being a little bit more lazy, slower. They tend to gain weight. They sometimes tend to have skin or hair coat issues as well. And all of these things, can be related to a low thyroid. Sometimes dogs too will have what we kind of call a tragic expression on their face, where they just seem kind of really sad all the time. You don't see it all the time, but that is sometimes one thing that we do look for in some of these in some of these hypothyroid cases. It is incredibly rare, and I do not think I have ever seen a case or read a case of hyperthyroidism in a dog where the thyroid level is incredibly elevated. However, that is usually what we do see in cats. Cats can be prone to hyperthyroidism as they age, and the signs of hyperthyroidism in a cat, or too much thyroid hormone being produced, basically are the exact opposite. You may notice cats that excessively groom themselves seem more hyperactive. They may be eating a ton, so they may have a voracious appetite, but they may not really be putting on any weight. And so, your vet will potentially want to look to check their thyroid level. And if their thyroid level is a little bit too high or extremely high, I've seen some very high thyroid levels in cats, what we will do is we will go ahead and first probably try to start them on a medication to reduce that thyroid level a little bit. Treating hyperthyroidism in cats is a little bit tricky because you have to kind of find the right treatment modality work. There's a lot of things in there. There's surgical corrections, there's radioactive iodine therapies that we can do, there's oral medications, there's skin medications where the medication absorbs through the skin. There's a lot of stuff that we can do for hyperthyroidism in cats, and we really try to start simple and then move on depending on what works. There's even a specific diet out there now for hyperthyroid cats that helps a little bit as well too. With hypothyroidism in dogs, basically the easy treatment is we just supplement them. We supplement them with thyroid hormone, and usually they do fine. Owners notice a change almost immediately as soon as their thyroid levels are, coming up and doing a lot better. And again, we monitor that with blood tests to make sure that their thyroid levels are in the same range where they should be. Sometimes we do have to adjust dosages a little bit. So thyroid is a big one, both high and low, that we may notice in senior pets. Finally, the last one, I guess you could sort of consider it a category of its own, but it does involve so many different body systems. I kind of put it in with the metabolic diseases, and that is cancer. Of course, as an animal ages, as we age, any animal that ages over time is going to be more prone to developing tumors. Some of these tumors may be benign, such as, fatty tissue tumors that we see on dogs all the time. Some of them may be more of a concern. Severe cancers that can affect the intestinal tract, that can affect the skin. Cats tend to be prone to developing more oral tumors, so we keep an eye on that very, very closely. So it's really important during these 6-month visits, every 6-month visits with your vet, that your vet really feels your animal, checks it out, make sure there's any new lumps and bumps. If you feel any new lumps or bumps or anything like that, you definitely want to let your veterinarian know and have them seen as soon as possible, because again, it's that ounce of prevention, pound of cure thing. If we find a tumor that even may be, show signs of a very aggressive tumor or cancer based on pathology or biopsy, we can get it out a lot sooner and much more easily if it's a smaller tumor that we can get a better margin on than if you let it go and grow and then it becomes a really major issue. So cancer certainly is something that we worry about in older animals, and there's so many different types. That can be a driving talk all on its own, and maybe we'll do that sometime. But of course, cancer is something else that we look for in these senior pets. We're going to kind of throw in, since it does kind of fit in with metabolic things issues, and I mentioned it a couple of times, is diet. Some older animals, senior animals, they can't process nutrients quite as well, either because they're suffering from a metabolic condition, or just as we age, we don't process nutrients necessarily quite as well. So there are diet types that are out there to help prevent weight gain and obesity in pets, to help, sometimes they're very easily digestible forms of proteins that are in some of these foods, so the pet's body doesn't have to work as hard to extract the nutrients, all of that. There are, as I said, certain diets for liver issues, certain diets for kidney issues, diets for diabetes, diets for thyroid, diets all over the place. So we do have all of that at our disposal, and it's certainly something you can talk with your pet about as far as the best diet for your pet to be there as they age. Something else that we all deal with as we get older, and our pets do too, is arthritis. And actually what's interesting with arthritis is it probably actually does start earlier in animals' lives, and probably in our own lives too, than we realize. And they just compensate for it well before it really starts to become a problem of achy joints and things like that. So again, sort of like with kidney issues in cats, all animals, if they live long enough, are probably going to develop some form of arthritis issues. And it is something that, obviously we can, keep an eye on, and certain signs that your pet may be suffering from a little bit more problems with arthritis would include them maybe not wanting to go as long for walks, maybe limping every now and then, all of a sudden feeling painful on a limb, taking a little bit longer to get up in the morning after sleeping all night or after a long nap. Sometimes they can actually you can actually see it with behavior changes too. If all of a sudden your pet seems a little more grouchy, or just not as willing to be pet, seems a little shy away a little bit more, or just is acting different, sometimes that can just be due to generalized low-grade pain from arthritis. So it's not uncommon for us to see that sometimes in senior animals, and as soon as we treat the issue or make them feel better, the pet's pretty much back to themselves. And there are a lot of things that we can treat now with, both with joint supplements and various medications, non-steroidal anti-inflammatories, different types of pain medications that are out there, physical therapy modalities, and other things like that. There's a lot that we can do for senior pets with arthritis nowadays. So it definitely is something you want to talk to your vet about, because we really can improve an animal's quality of life if arthritis is just a kind of an issue. So keep that all in mind. Of course, as the saying goes, no teeth, no animal, no teeth, no life, and it's the same thing in our dogs and cats. Dental issues certainly become more prevalent as an animal ages, just as it does with us, and it certainly is something that you definitely want to have your pets checked every time they go to the vet. Make sure their mouth looks okay. Cats can develop very painful lesions in their mouth, so you may notice that they don't want to eat. They try to eat, but then they growl, or they paw at their mouth, or they just totally ignore the food altogether because they know it's going to hurt. Dogs, especially smaller breed dogs, can develop very, very horrific dental disease that can lead to severe dental infections in their mouths, and we really want to try to keep those teeth as clean as possible, because again, we want to, that's how they eat, so we want to make sure that they are pain-free in their mouth and there's no sign of major infection setting in various areas, things like that. So you're definitely going to want to have their teeth checked. We usually try to recommend a good dental cleaning at least once a year with senior pets, so this way we can do dental x-rays, but again, we can find those problems before they become major issues that, one, are involving a lot more treatment for your pet, and two, saving money from your wallet, because we can treat these things a lot more inexpensively if we catch them early. So remember that with dental issues. Some animals, when they're older, again, just like us, may be more prone to certain heart conditions or heart disease conditions. The one thing I will say about that is we do not usually see, it's very, very rare, that we would see issues with pets developing the same type of cardiac disease that humans do. So clogged arteries, atherosclerosis, severe cholesterol impaction in the coronary arteries, things like that. We just don't see that in pets, and usually the reason is they don't live long enough. I mean, if you think about it, unless there's a genetic predisposition in a person or that particular animal, this is something that takes decades to occur, and most animals are not living past 15, 20 years old nowadays, despite our best intentions and everything. So just keep that in mind, that when we're talking heart disease, it's usually an issue with a heart valve, some structural defect in the heart, or things like that that may creep up when the animal's a little bit younger, and it's just something that has to be monitored, or it could certainly be something that all of a sudden has occurred. So that's why we really stress these 6 months visits in these older pets, because we want to listen to their hearts, we want to listen for changes, and we want to catch them early. There's a lot of things that we can do for heart disease and the secondary issues that develop because of it in these pets, but we have to be able to catch it. We have to see your pet in order to be able to diagnose and treat it. If some things you might notice that might suspect or get you to suspect that your pet may be suffering from a little bit of heart disease, or a lot of heart disease, or heart disease of any kind, would be them, again, maybe not wanting to go as long walks, is what the vet is trying to say here, appearing more tired in play, tiring out more easily. Sometimes we'll notice coughing with it. Sometimes we'll notice when they're sleeping too, their respiratory rate seems still elevated. So they just seem almost like they're breathing a little bit more heavily at times. And if you notice any of those signs, certainly obviously have them checked. It's not necessarily their heart, but it's always a good idea to have them checked to make sure there's not anything else going on there as well. So the final of the 5 things that we're going to mainly focus on here is probably one of the biggest areas that we're seeing much more done in lately and researched, and that is in the area of senility, cognitive dysfunction. And so we do know now that pets do suffer from forms of senility, just like you or I would. We do know that it can be very debilitating for them and for the owners, and it can be very stressful for them and for the owners. So that's something that we definitely need to keep in mind as we kind of move forward. And signs of senility in an older dog, and we do see it more in dogs. Cats, we're still trying to learn a little bit more about it, but would be signs where their behavior changes. So we may notice their sleep patterns are different. They may be more active at night than they used to be and sleep more during the day. They may appear to not know where they are. They may just wander the halls of your house, wander around a room. They may become more vocal. They may just bark for no reason or howl for no reason. They may sometimes stare at walls. They may just kind of be there and just staring at a wall, nothing else. And again, some other behavior changes in there as well. And if you notice any of these things, it certainly is something you want to bring to your vet's attention. We don't have great medication for cognitive dysfunction right now. We're getting better with it, as some of the human meds are now coming over to veterinary med with it, but there are things that we can do for senility. We can't cure it, at least not that I'm aware of right now, but we are making strides in treating it and making things much more comfortable for your pet. Senility is not necessarily, and it's not like a pain type of thing with your pet. It's more of a stress type of thing with your pet. So and anxiety. They may get more anxious because they don't know what's going on. They feel lost. They feel a little weird. So we treat these with certain medications to help the actual dysfunction, but we sometimes will also treat senility in older pets with some anti-anxiety medication as well. So you definitely want to keep that in mind and talk to your vet about that. We've got some great anti-anxiety meds that work very, very well in pets for cognitive dysfunction and for other anxiety issues as well. So those are kind of the top 5 areas, that we focus on a little bit more when we're looking at senior pets. A couple of other really quick areas that I'll touch on here. Obviously, their eyes and their ears. Older animals, just like older humans, the hearing starts to go a little bit, the sight starts to go a little bit. Older animals are prone to cataracts, just like us. There are cataract surgeries that are out there, just like ours, that can be done by a veterinary ophthalmologist to improve sight in your animal. But if it's a progressive kind of loss of vision or decrease in vision, cataracts we talk about, usually it's the equivalent of trying to look through stained glass more than anything else, and an animal adjusts to that very, very well. Usually if there are some sight issues that start to develop in older pets, we recommend having some night lights in the hall, so this way they're not, they're able to see a little bit better. We recommend not changing a lot of things going on in the house as far as furniture locations or new additions or things, because pets really do memorize where these items are. And so they can navigate pretty well. With hearing, it's true deafness or total hearing loss in an animal can only be determined through very special tests that are done in referral centers or universities, but it's not uncommon for hearing to decrease a little bit. So you may have to adjust the way you talk to your pet, adjust the way you give them commands or make requests of them, things like that, to adjust for a little bit of that hearing loss. If your pet happens to be intact, so they are not spayed and neutered, we obviously do see an increase in potential health issues secondary to not being spayed and neutered. Mammary cancers developing in dogs and cats if they're not spayed. A uterine infection called a pyometra, which can be life-threatening in an older female dog or cat that is not spayed. Prostatic issues, both increase in size of the prostate and potentially prostatic neoplasia or prostate cancer in pets. So those are kind of the big things that we look for, that we notice in pets that are not spayed and neutered. Testicular cancers can come up and be a problem in there as well. Another question that usually gets asked, do I have to get my pet, older senior pet, vaccinated as often as I used to? And every vet differs a little bit on their opinions on this. Every state is a little bit different on what the laws require, but I'll give you my personal opinion on it and what a lot of other vets are going to, and the answer to that is no. They probably do not. Now, a lot of this depends on the lifestyle, so you definitely want to talk to your vet about, is your pet still hiking with you? Are they going indoors or out? For cats, are they indoors and outdoors? Are they spending a lot of time in the woods? Is it more of a city dwelling area? You know, all of these things are really, really important to remember and to discuss with your pet. But in most cases, the big vaccines are still going to be rabies. We definitely still want to make sure that we vaccinate them for rabies. And that usually is about every 3 years now. Most states have gone to that where they accept the vaccine every 3 years. For the other basic course, so the distemper parvo combinations, the panleukopenias, things like that, I personally usually go to every 2 or 3 years when they get much older, because I feel the protection is there. For things like Lyme or lepto vaccine, Bordetella, kennel cough, those sometimes still do need to be given yearly because the protection just doesn't last more than a year with those vaccines. It's something you definitely want to talk to your vet about and formulate an own specific vaccine plan. And don't be afraid to refuse a vaccine from your vet too. If, you know, we are giving recommendations of what vaccine should be given. Rabies is really the only one legally required. You can't really argue with that one because that's a law. So you can't really argue out of the rabies vaccine one unless your pet is very, very prone to allergic reactions or autoimmune conditions secondary to vaccines. There's ways that we can work around that with checking protection levels and writing letters and certifying that the animal does have a major medical problem that would make vaccinating that pet more dangerous than not. You know, talk to your vet about those things. But, you know, usually with the vaccines, when they're much older, if all I really focus on is rabies and distemper, parvo, panleukopenia for cats every 3 years or so. And we take it year by year when we look at them and then assess their health risks, how their health status, and, you know, if there's any lifestyle changes, and we base our vaccine protocols based on that. Final area is horses, and I'm not really going to get much into horses. I'm going to look to hopefully be taking a ride pretty soon with a very, very good vet friend of mine who deals explicitly with horses. There's a lot of things that you have to think about if you are adopting or dealing with a senior horse. Far too much to get in here on this talk. That is a talk all on its own. I wanted to kind of focus this one just on dogs and cats, and you know, that's kind of a totally separate topic. I have not forgotten about horses, though. I want all those horse lovers out there to know that we do realize it's a major issue, and hopefully we will be having a drive through the countryside and talking to an equine vet about that pretty soon. So that kind of covers everything in a nutshell, so to speak, of senior pet care. And so we're going to now, of course, wrap it all together once again with Doc's top 5 takeaways that we hope everybody should remember from this little drive and chat. And, of course, the first thing is age, remember, is not a disease. Just because they're older doesn't mean they're going to be more sick, doesn't necessarily mean that they're going to be worse off in any way. Age itself is not a problem. Now, there are certain things that come along with that age that we have to be more cognizant of, but, you know, just because a pet is older doesn't mean it can't be the same great pet you've always had or are going to adopt. Number 2, senior animals, and this kind of ties into it, make outstanding pets. They really do. You know, you don't have to worry about any of that puppy or kitten training, putting up with any of that craziness, especially if you live a busy lifestyle. Sometimes a senior pet is great. They are more adapted to home living. They're more easygoing. They just want a little bit of love, and, you know, they'll just hang out with you. They're not going to be crazy running around. Some still do, you know. Any lab owner knows that they probably don't calm down until they hit about 15 years old. But, for older cats, I mean, really look through your shelters and your rescues, folks, because the majority of the time, the ones that really are looked over are the older pets, and they really do make great family members. Number 3. We really want to stress the importance of seeing your vet with your senior pet every 6 months. Again, and we want to be able to catch things early. We want to make sure that we're not missing anything, and we want to make sure your senior pet stays as healthy as possible through the golden years. Number 4, we can treat many senior diseases very well now, and just because your pet has found out have a liver issue or maybe a kidney issue or diabetes or senility or any of the other things that we've talked about doesn't mean that we can't treat it. We can treat it very, very, very well in a lot of cases, and we can, provide many years of quality life for your pet. So don't think that any kind of condition that I've mentioned here or any kind of condition that may show up in your senior pet is a death sentence. It's not. So please remember that. And number 5, as I kind of said again, early intervention is key. So that's why we push for the 6-month visits. That's why we want to make sure we get on top of issues before they get more serious or complex. If we can do that, we can provide much better care to your senior pets than if we are presented with a problem that has been fulminating for months or years that we then unfortunately can't do much for, or is incredibly expensive to try to correct, and we can't even guarantee sometimes that we're going to get as much quality of life out of the treatment as we would have been able to if we had seen the issue a lot sooner. So I hope that kind of answers some of the questions that come up about senior pets, and gives you a little more information as to what you need to know when it comes to senior pet and senior pet care for your pets. And as always, if you have any questions about your senior pet, something I may not have covered, or if you're looking for another topic maybe for us to cover, you certainly can drop us an email as drivingwithdoc@gmail.com. Again, drivingwithdoc@gmail.com. The email is up and active now. I do apologize because the last time I realized that something happened and it was not active. So anybody that emailed and maybe it got bounced back, I do apologize for that. We've got it up and it's working now and everything's good. So drivingwithdoc@gmail.com, and hope everybody considers maybe getting a senior pet as we come to the end of Adopt a Senior Pet Month. Doesn't mean you just have to adopt it only in November. You can adopt them all year round. Trust me. Any senior pet is going to be looking for a lovely home, and any pet that you may have that is now going on into their senior years is really going to love you for making sure that you take that just extra little bit of care for them to make sure that they stay happy and healthy. So I am Dr. Brian Langlois. Thanks a lot for coming along with me, and who knows what topic is going to emerge next the next time we go driving with Doc.